Right, the possible hepatitis A exposure at Tabitha's Way food pantry is one of several in the last few weeks that we've been reporting. Customers who went to the Sonic on Main Street in Spanish Fork on December 23rd and 24th may have been exposed to the virus. Also, people who ate at the Olive Garden in Spanish Fork between December 21st and December 30th. The same goes for nearly 12,000 people who shopped at a West Jordan 7-Eleven. And now, here to help us understand hepatitis A as well as how to stop it from spreading is Dr. Brandon Webb from Intermountain Medical Center. Thank you so much. And you're in the Infectious Disease Department.
That's right.
This is a very important and timely topic. What exactly is hepatitis A and what are the symptoms?
So hepatitis A is a viral infection of the liver. It can cause a fairly severe acute infection. Symptoms include fever, jaundice, nausea, vomiting. So the symptoms are distinctly different from influenza or some of the other common viruses.
I know hepatitis A is tricky because that incubation period could be 2 weeks to a month.
Right, that makes it more challenging because once someone's been exposed, they can actually be contagious for a period of time before they start having symptoms themselves. One thing that's important to remember is that unlike hepatitis B and C, which are totally different viruses, hepatitis A doesn't cause a chronic disease. And although it can make people very ill, it doesn't cause cirrhosis or chronic liver disease.
Which is good to know. And so people who might think that they've been exposed, they're all being urged to get the vaccination, which is good for life.
Correct.
How many cases do we have in our area?
So in the last year, there's been roughly 150 cases that have been reported.
And last year we only had a handful, so this is a true outbreak, and we keep hearing more of these stories. The main message you want to get out there is
the population that's affected. So hepatitis A historically has been a public health concern because it is spread through poor hygiene or inadequate sanitation, and that affects groups where they're more vulnerable to those things, like the homeless population and those who use IV drugs. And in this outbreak, 80% of our cases have been in those groups.
And the thing is, when we say that, it is isolated to that population, but they live all among us. And as we can see, the outbreak that has affected and impacted hundreds and if not thousands.
Right. So a couple of things to remember. One, you can't overstate the importance of the simple things. So good hygiene, washing your hands, especially this time of year. Two, there's a very effective vaccine available, and it's been part of the routine childhood immunization since 2006. So almost all of the children who receive vaccinations are protected. Adults are not routinely vaccinated for hepatitis A, but adults who have possible exposures either through their profession or through activities they participate in or travel are encouraged to talk to their healthcare provider about the vaccine.
Such an important message, and I know we haven't quite gotten a handle over this hepatitis A outbreak, but certainly the message you guys are giving out there is spreading, right?
Yep.
All right, thank you so much. With Intermountain Medical Center, that information, you can find that on their website. And Dr. Webb, thank you so much for all of that information. Coming up in entertainment news.